All right, what do you do when your doctor says to you you can't squat? We have all these people in our society. I think it's like over 80% of the people in our society at some point in their life are going to be diagnosed, have, or have had some type of back pain. So it's an issue because we have people sitting all day, we have people looking at computers, we have people sitting in cars and driving all the time, we have people not working out, overweight, intestinal inflammation, on and on and on, and people are having back pain. Now, why they have the back pain, who knows? That takes some skilled assessment because you could have GI problems causing back pain. You could have food intolerances that lead to back pain. You can be constipated that leads to back pain. It could be emotional issues leading to back pain. It could be muscle hypertrophy and hypertonicity leading to back pain. It could be facet joint inflammation, spondylolisthesis, retrolisthesis, DJD, DDD, spondylosis, retrolisthesis. Any of the 7 types of disc pathologies. Could be some type of fusion, could be instabilities, could be SI joint problems, on and on and on. So the key is that you need to figure out, by working with a skilled check practitioner, physical therapist, skilled practitioner that assesses you, to figure out where your back pain is coming from. Because the key is you actually assess treat each one completely different. So that's the first most important thing. Secondly, I actually should say this before I even show you the parts of the video. I'm not here to diagnose you. I'm not here to tell you these exercises are going to fix you. I'm just here to educate you that if you're working with someone, if they have not done an assessment and doing a cookie cutter program with you, leave. Go find someone that's going to take the time to assess you. Now, what happens most of the time is after you go see your doctor, they do an x-ray, which makes no sense at all. Then you actually have to go to physical therapy and fail a bunch of times before they do an MRI to see actually what's going on. They'll say, you need surgery, or you have this, what's wrong with you? They don't really tell you what to do, they tell you what's wrong. And a lot of the times, what they'll say is, don't lift anything over 10 pounds, don't squat, don't do A, B, C, or D. Well, the question is, it's a primal pattern. You need to do it to eat, to poop, to sit at the table. We've kind of talked about this already. So I've designed some techniques that I learned from my buddy Paul Check from, working in the industry for so many years. Some of this might be new to you guys. Some of this might be you already know. But the bottom line is, if you have low back pain, I don't care what type of low back pain, you should be able to squat, and you can squat. And you'll see in the next couple of clips from my beautiful wife in this showing you that you can squat without compressing the spine. Now, this is from a rehab perspective because we have a lot of people come to us that need to be squatting. Let's say they were a skier and they need to squat, but they have a disc pathology. We can't have them squat with load initially because it's going to cause pain and compression because of gravity and the load. One of the things that you can do to work with people when they have low back pain, there's a science to it. So it goes way beyond this YouTube clip. It's a science. But the key component, one of the many key components is if you can really overwork and overstrengthen the leg complex from the hips down, you can help compensate for a weak back. You can do this with 1 1/4 squats. You can do this with just regular squats. Now, depends what position you're in. You can do this with hip extensions, because a hip extension, you'll see, is actually a regressed squat in a decompressed position. You're in a gravity-eliminated position. A squat is basically a standing hip extension. So the key is, if you can over-strengthen and overwork the legs, the type 1 fibers in the legs, as well as the type 2, the right way, while working with a client, and this can be even non-loaded, trust me, I've done it with people, because of the fibers from the ankle all the way up, the peroneals, biceps, femoris, in the sacrum, in the sacrotuberous ligament, the SI joint, the paraspinals, on and on and on. But also you have the glutes, which, of course, when you're squatting, are a major phasic muscle. They get you from that seated position up. They're major hip extensors. They're major phasic muscles. So they want that type of load, that type of movement. Now, when you have the pain initially, you can't load that much, but if you overwork them and you build them up, what you're going to do is you're going to strengthen the back, because the glutes not only attach to your TFL and the IT band, which we've talked about before, the glutes actually attach 20% of its fibers to the coccyx and the pelvic floor, so it's actually quote-unquote part of the inner unit. Those fibers are actually tonic. But it actually attaches to the thoracolumbar fascia and the opposite lat, kind of like in a crisscross mechanism. And that's the posterior oblique system, which stabilizes you in the transverse plane. So if you can strengthen that system, you can actually help stabilize the low back. because the glutes or the pelvis create a platform, as well as the ankles, hips, and the ankles, knees, and hips create a platform for the low back, right? And if you think about it, the lats are the only connection between the upper body and lower body. So enough of me talking. Here's basically 3 exercises or progressions, starting with the supine back extension on a Swiss ball, and of course there's many variations. The key is to go straight up and down, inhaling on the way up, exhaling on the way down, pushing through the heels without the knees caving in. That's to work your hip extensors and the glutes. Then you can progress it to a gravity machine squat, which is a little bit more compression, but not too much. You could do just regular squats on that. You could do 1 1/4 squats on that. You could do weighted squats on that, still decompressed. And then you can actually, over time, when you're training them or you're going through the rehab phase, you can have them do a standing squat. Yes, you can stand and squat without being loaded. You can use a belt. You can get a special belt to do it, or you can just use your regular dip belt that you'll see in this video, attach some weight to it. They're squatting, working the legs, benefiting the back, but you're also decompressing the back because of the traction from the weight on the weight belt. So you're actually decompressing the spine as you're squatting. So hopefully you've learned something that goes way beyond this YouTube clip. But if you're in the area...
What I don't want, just come on.